Right, guys, we're now recording, which we always do. I think I've remembered everything. Anyway, Happy New Year, everybody, for those of you who I haven't spoken to, which is quite a few of you. So Happy New Year, and I hope 2022 is going to be a slightly easier year, one where we can actually get to see each other and not spend our entire life on computers, which will be fantastic. Paul, can I assume that's you? Paul Fenton. Oh. I was hoping Paul was going to be here, and there's just one called Montreal Webinar, which makes me think that maybe that's him.
Not Paul.
Oh, is it not Paul?
No.
Oh, sorry about that.
No worries.
Oh, but there is a Paul that's turned up. I wonder if that's Paul. Paul Fenton, are you there? No. Okay, I'm going to give it 3 more minutes. We're now on nearly 70 people, so just we always have a couple of extra minutes, and then we're going to get started. Hi, Oliver. Happy New Year.
Hello.
Hello. Right, 73. I think we are approaching being ready. Fran, we don't want to know it's sunny. It's definitely not sunny over here. It's like cold and grey and miserable. I don't know how many of you are in the UK, but it's cold and grey and miserable. Right, so I think we can start. So I'm going to put my camera on and say hello, everybody, and Happy New Year, and welcome to the reference model call. I'm going to ask. Somebody's making a lot of noise. Anyway, right, welcome. 3 minutes past. Hopefully, we've still got people joining, but I think we should start. And I've got Fran on the call, which is very important because Fran's going to be helping me. So I'm going to do a couple of the bits at the beginning and then hand over to a variety of people. So I am recording for those of you, just so you know, and this will all be available on the website. So this is the agenda for today. Just a tiny touch on the community, just as a reminder of what a big community we are and how wonderful we are as a community. We're then going to talk a little bit about steering committee elections. There are elections coming up, and I wanted to just make sure that you were aware of the election process as such. Hopefully Alison's on and we can talk a little bit, just an update on the website as to what's happening with the website. Jamie's then going to talk about the TMF plan template and a call for volunteers. I'm going to talk about the CDISC position paper and a little bit about CDISC. That's why I was hoping the Paul was on, in case there were lots of questions about it. And then we're going to hand over to Fran to talk about the bit that I think everyone's really interested to get into the detail on, which is around remote GCP GMP inspections. And then we have a panel, and then a bit about upcoming meetings and the next meeting. Yay, Paul's here, brilliant. Hi, Paul. Okay, so let's talk a little bit about no. Oh, that's brilliant. So somebody else's dog barked before mine did. I'm over the moon. Right. So steering committee. I'm talking about our community. Just as a reminder to everybody, there are nearly 100 of us, fantastic, on the call today. Just as a reminder about us as a community. So we have a steering committee of 13. We actually have one true vacancy at the moment. We have 329 active members. We have 1,517 people who subscribe, and we have a LinkedIn community of 3,928. So an amazing, amazing community of TMF people. But today I really want to talk about the steering committee, because every year there is a process for new members to join the steering committee. And I'm putting a call out to make people think about it slightly earlier this year. Usually it's around about March that we go out and we have the voting, but I really wanted to just talk through who's on the steering committee and to say thank you very much to somebody who's leaving, and also to just make people think about whether they want to be involved in the steering committee. So this is everybody on the steering committee, and Jamie, we got Fran very kindly put your company in there, so we've got your right company, and hopefully everything else is right. But that's the list of the people on the steering committee. I think I'm right in saying that it's myself and Alison and Mary who are up for being re-voted in if we want to stand again, and if we get re-voted in again. Russell is resigning from the committee, so Russell, I'd like to formally say thank you very, very much for all your hard work and everything over the last few years. Obviously you're not disappearing, you're just not going to be on the committee anymore, and we have one spare space for the committee as well. So we're actually going to have five vacancies. The steering committee, the members serve 3-year term. We have elections every March, April. It's not absolutely set in stone when it's going to be, but it's around that period. So an important thing is that you have to have been, if you're interested in being on the steering committee, you have to have been involved as a reference model as part of groups.io for the last 12 months. And you need to be as part of a team. So it can't just be somebody who's just thought, oh, that'd be quite fun to get involved. You really do need to have been supporting and working with the reference model to be able to actually stand as part of the steering committee. We meet every 2 weeks, and you have to come to at least as many meetings as possible. I think it's 70% of the meetings and 50% of these scheduled meetings. Oh, and you've got to be a TMF loon. TMF is too much fun, and you have to be prepared to have a bit of a laugh about TMF if you want to be on the steering committee and really get passionate about it. So it's going to be a 150-word nomination. The reason I wanted to tell everybody about it today was to say, think about it. When the email comes out, which it will do at some stage to everybody on groups.io, then you can think about submitting your application. It then goes to vote, and everybody votes, and those people who are lucky enough to get voted on are part of the steering committee. We do have some rules, like, for example, at the moment, no stakeholder group can represent more than 50% of the steering committee, sponsor, vendor, CRO, consultant. And I think we may change that at some stage to try and have a few more sponsors involved, because we really do want to make sure we have. So if you're from a sponsor company, we'd very much, obviously we welcome everybody, but we're very interested in sponsor company people. And then obviously geographically, we can't have everybody from one area, although what will be interesting when we get to the polls for Fran's piece is looking at how we're comprised today. So that's a little bit about the steering committee. We do obviously have a chat. So if anybody wants to ask any questions about being on the steering committee or ask anything, all the steering committee members, almost all of them, are on this call today. So therefore they'll be able to give you some input if you want to see. Okay, so that's a little bit about the steering committee. I then wanted to talk a little bit about the future of the reference model and talk a little bit about the CDISC position paper. So hopefully, can I mute everybody? Let me try and mute everybody. Mute all. Okay, I'm muting everybody but myself, I hope. If I've muted myself, can somebody just tell me? Hopefully I haven't. Actually, that's a really silly thing to say. I'm really sorry, because obviously if I muted myself, you wouldn't be able to hear me. So I can't have muted myself. Right, okay. On with the show. So the CDISC position paper. So there was a position paper that we put together on our proposal to move the TMF reference model under the CDISC umbrella. We had a vote as per the last call. I'm not going to go into a huge amount of detail, but obviously we always want to give you guys the opportunity to ask any questions or make any comments. So the position paper was released on the 19th of January, and it's going to be available for comments until the 9th of February. And you just email cdisc@tmfreferencemodel.com with any questions or any comments that you want to make. The slides will be up, and there's obviously a link in the slides which will still work, so you can get to the position paper. It's on the reference model website, and what's going to happen is we're going to hopefully get some comments back or questions back, and then we will meet in early March. So I guess that depends on if we get any comments. If we don't get any comments, it might not be as quick as it might not need to wait to early March to ratify the decision based on the feedback. And then obviously we're going to have an implementation plan agreed by the end of March as to how we're going to move forward, assuming that everybody's happy with it. Now, I can tell you now that we haven't had anybody comment, and it's not that we specifically need comments. It's just if anybody does want to make any comments or have any questions, please do submit them. Feel free as well to post them here today if you've got any questions or comments. I thought it might be useful just to run through, because there'll be some people on this call. So we're at 110 people. There will be some people on this call who haven't heard this before. So I'm not going to go into great detail, but I'm just going to highlight a couple of the things about CDISC. So first of all, who they are, Data Standards, Interchange Standards Consortium. And I think there's a couple of very key things to note. One is they are a non-profit organization, and the other is that they develop standards. And they also have a team of over 40 people working for them. So not just volunteers, but actually working for them. So that's some of the things that we are going to be bringing in assuming we move into the CDISC direction. Just a couple of notes, and I left them in these slides as well, not so much to go through them, but more to just give people a source. So if you want to come back and have a look at who CDISC is, etc., it's all in the notes. What do they offer? Well, as I said, they're a formal standards organization with resources, with technical resources, which will allow us to support the reference model from a database perspective. And they will also have dedicated staff for training, for events, for all sorts of things. And what does this mean for us? Well, what this means for us is that we can carry on as we are. Essentially, we will have a community of volunteers who will be helping guide the direction of the content. We will have a steering committee governing the model. Names may change in the future, but essentially what we're going to be doing is carrying as we are, but having the backup of an organization with funding and resources to allow us to extend what we do, to move towards being a standard, to get more formal ties with regulators, and to effectively allow for our systems to talk to each other. So there's a huge, huge advantage to doing this. Obviously, there are a lot of things that need to be considered. So, you know, when you read the position paper, if you've got any questions, got any comments, make sure you post those questions or comments by sending an email to cdisc@tmfreferencemodel.com, whatever the email was before. Now, the reason I've gone through this very quickly is we did this at the last meeting. So if you want to hear more about it from the last meeting, go back and look at the recording. Anybody got any questions or comments on that? Great, I'm going to assume no, and I'm going to move on. So Alison, if I could hand over to you to talk a little bit about the website and where we are with the website.
Sure. So the website team working group has been taking a look at this website to try to figure out a good way to make it have a more modern feel to it. As well as to sort of streamline the menu so it's a little easier to navigate based off of feedback we got. You know, where do people search a lot through? What kind of information are they looking for? And what's an easy way to get to that? So for example, you know, somebody wants to submit something to the change control board. You know, hopefully it'll be a little bit easier to navigate to that place in the new website look. And so our goal is to have the website modernized and refreshed by the end of the quarter so March timeframe, and release it for the end users at that time. Any questions?
I've just seen one question, Oliver, about whether the reference all will be hosted on the CDISC website if it proceeds versus having a dedicated website. And whilst we haven't had detailed conversations about that, I'm quite convinced that at some stage there will be a transition of our website because we will be part of CDISC, assuming that we proceed.
Yeah, and that's why the team is not going to spend a lot of effort creating a whole new website, you know, generating and programming and creating something very new. We're going to go with some good advice from Eldon and use the templates that are out there and available. There's thousands of them, and try to just refresh the look and then move some things around, just in the anticipation that if we do join a standards group, they probably will have something they would like us to use. So we didn't want to put too much effort, but we still feel like that could be a while. So let's get something workable in place for the short term.
Absolutely. Thanks very much, Alison. I don't see any more questions. So Jamie, can I hand to you, talk a little bit about the TMF plan template, please?
Sure. Thanks, Karen. Hi, everyone. So the TMF plan template went live just about 4 years ago. Seems only like yesterday. And that was with a group of about 12 people across the industry, vendor, sponsor, consultant, etc. And so we have held 4 workshops about the TMF plan template. There's still a lot of interest in it. And we wanted to now take a look at what needs to change, because I'm sure with the changes that have come through from the pandemic, there's items that we might need to change or subtract or what have you. So if you're interested in joining, for lack of setting up a group right now, you could just send me an email and I'll work with Eldon on reestablishing the TMF plan template, groups.io, which we need to do. So raise your hand and send me an email. Thanks.
Of course, Jamie, they also could possibly just put something in the chat as well, just because sometimes people think about things when they're on the spur of the moment. Yep. So
I just didn't want to leave it so that they had nowhere to ask anyone anything. So
yeah, no, absolutely. So great, thank you very much. Okay, so I am now going to hand over to Fran to talk about the main topic of today, which is the remote inspections. And Fran, I obviously have the polls lined up, so just let me know when you want. I split them into 2, demographics and the actual inspection. So let me know when you want me to do that, and I will hand over to you.
Fantastic. You know, Karen, why don't we do the demo poll now, and so everybody can get a sense of who we all are listening in today. Thank you. So 2 quick questions about who's on the call, and hopefully we've got a great representation of people from different parts of the world and in different roles. So upon which continent do you reside, and what role do you play in our wonderful world of clinical trials? Well, people are filling out the poll.
I can tell you, I can never remember what you can see. I don't think you can see much. But what I can tell you is that we have 109 people on here. So what I was going to do was wait, well, obviously excluding me, 108 who can answer. And I was going to wait until we got to, I actually think we're probably going to get to 100 at this rate because we're very close to it. So give me one more second. Anybody else want to, anybody else for anybody else? Okay, I think it stopped. It's at 90. That's pretty good going. Guys, you're all awake, which is fantastic. 95, 96, 97. Oh, come on. Are we going to hit 100? No, you never get 100 people out of 108 answering polls. Right. No, 98. That's good at 99. I was going to say it's good enough for me. Right. Okay. I am going to officially end the poll now and then launch the, we made 100. Yes. Right. I've ended the poll and share the results. If someone could please take a screenshot, and whoever does it, shout out so that we know, so I don't get 40 emails.
God, can we rely on you? You're such a good screenshot guy.
I got it.
Fantastic. Thank you very much. Okay, so there
So
you go.
heartening to see some representation from Asia and Africa. We really appreciate you guys dialing in very strange hours of your day. Heavy in the North America, not unexpected, and heavy in Europe. Our Australia friends are wisely sleeping now. We've got a big chunk of folks here from the eClin vendor and consultant space. A trial participant. We should have had more than one choices. I just joined a clinical trial. But anyway, somebody from a trial site, hooray, we're so glad you're here. Trial sponsors make up a heavy portion of our community today, which is wonderful because we're talking inspections and want to get as many participants in the panel as possible. A lot of CRO folks and other. Welcome, everybody. So it's been tough for me to figure out what to call this. I say ICMRA. I'm not sure what they say. It's a really difficult acronym to pronounce. This is a group. Karen, if you can go to the next slide. The ICMRA is a group of health authority inspectors who have many different topics I'm sure they discuss, and they have a working group that is involved just with the inspection, a nightmare of dealing with inspections during COVID-19. So they posted a reflection paper out, and it's called that long official title. The final version came out in November, and the URL is there. If you go to the next page, Karen. So what I've taken here is some quotes from the paper, but highlighted words of interest. This is my highlighting, not theirs. It's a 15-page paper, but it's relatively dense to get through. So encourage everybody to, get on the URL and read it for yourself. The thing that struck me very heavily as I was reading through it was how many different parts of the world this working group represents. You can see in the very small font in there that involved FDA, EMA, et cetera, et cetera, et cetera. And so when you read the reflection paper, you can almost hear different voices from across the planet. So the paper is a little bit academic and dry to get through, but encourage anybody who's got a deep interest to check it out. It covers both GCP and GMP remote inspections. And basically the health authorities had to, as did all of us, use digital technologies to support getting their work done. The reflection paper talks about both GCP and GMP inspections during the COVID period. Go to the next slide, Karen. So straight from this sort of overview perspective to a conclusion perspective. So the health authorities have found that remote inspections have to keep going forward because of our travel restrictions in our lovely pandemic times. And they declared these digital technologies as enabling, but not perfect. They don't believe that every inspection going forward, pandemic or non-pandemic, is going to be remote because of the difficulties in conquering the world of remote inspections. So the notable limitations we'll go through in the next slide. I think the thing that's really interesting to me is that irrespective of the difficulties of performing remote inspections, there were no notable differences in inspection results. Next slide, Karen. So these are not quotes from the paper. These are Fran Ross language here. And my conclusions about what's covered in those 15 pages is a high level of frustration from the inspector's perspective on the numbers of different technologies they'd had to conquer. So it's not like one size fits all for the tools that they were able to use. They were relying on the sponsors and CROs to provide tool sets. And so different companies use different tools. And so every remote inspection's got this unfortunate difference about it. So it takes more time. It's more time for the health authorities to plan it, more time to get the whole thing structured with their inspectee, and more time to complete an inspection remotely. The paper reflects that they are uncomfortable with having to use remote technologies so that there's no possibility, especially from a GMP perspective, for them to just drop into a facility that they want to see improvements on, or drop into a facility about which there are problematic questions. And you can really read throughout the paper. Their frustration was video conferencing technology. It's the best tool you've got for remoteness, but it's a very difficult tool to apply to an inspection practice. It's not viable for GMP facility inspections. Having people walk around the facility with cameras, very difficult for the inspectors to conquer that mountain. It's not helpful for reading the room. People can go dark when they're on a remote video conferencing tool, and you can't do that when you're in the room. And it's very difficult to facilitate systems access for inspectees' systems when you're using a tool like Zoom. So, next page, Karen. Oh, excuse me. Oh, thank you. So this is the Fran Ross advice for ETMFers. I think that all you can do for when faced with a remote inspection is plan ahead, right? And perhaps choose different health authorities as you do your dry runs, because different health authorities inspect GCP in different ways. Plan for the worst and then expect the best outcomes, and know that it's going to take you all more time, and it's going to be more effort to host remote as well as, you know, deal with a remote inspection. The results coming in, the health authorities say, are no better and no worse. So from a TMF perspective, it's the same old, right? You want complete and accurate records handled in a timely fashion. And I think as a community, especially, you know, being a set of TMF geeks, we tend to dial into perfection, and we all need to remember what we have to adhere to is GCP, which is good clinical practice, not perfect clinical practice. So do your best, take a risk-based approach, and you know, don't expect 100% of anything anytime. So wanted to now go into some Q&A and rely on my steering committee members and anybody else who's in the audience who has gone through a remote inspection over the past pandemic time period. So Karen, if we can throw up the other poll.
Absolutely, no problem at all. Hold on a second.
Welcome, Mary. Anyone on the steering committee that wants to jump into the panel, please get your camera going.
Okay, hold on. Okay, one second. I think I'm doing something silly. Give me 1 second. Oh, that's right. Sorry, I need to, at the top, ignore me. Right, okay, try again. Here we go. Launch the poll.
So from the start of the lockdown, if you could let us know if you've had a remote health authority inspection. We tried to include some health authorities because we don't have a blank box in this polling tool. So FDA, PMDA, EMA, MHRA, other, there's a comment section down below. Is there, Karen? Do we have a comment?
No, there's no comment section down below. The comments needs to go in the chat.
In the chat.
So anything you want to do needs to go in the chat. Now, the other thing I would say is that we have put the questions where it says not applicable to me. So if you are a vendor, if you are a consultant where you don't get inspected, please still answer the questions. And I know for a fact that 100 people answered the last question. So that means that I should get 100 answers to this question. And we are on 52.
Sure. So
So
a few
there's
more
enough
questions.
place to do the comments. I don't know.
No, you
In the
have to put the
chat.
comments in the chat.
Oh, in the chat. Gotcha.
Yeah, there's absolutely nowhere to make comments, unfortunately. Okay, so 83. Come on, a few more. And then I'm going to, and there's Fran, I'm assuming you've got the comments open. There's lots of people commenting and things.
Do that. It's wonderful. Thank you.
Yeah. So on the last one, want to jump on the remote inspection panel to discuss your experience. And there's yes, that 11 people said yes so far.
Come on up.
So-
Start your
so
cameras,
Fran-
folks.
So
Appreciate it.
yeah, and Okay, we're at 90. Is that enough, Fran?
Sure, go for it. Let's see.
Okay, I'm going to end the poll. Jamie, can you do me the screen grab again, please? Thank you.
Absolutely.
Right, there you go. I've ended the poll.
It
We're not
hasn't come up.
seeing
Yeah,
results
I'm
yet.
like,
Hi, Julie.
Fran,
Yeah.
can you see the answers okay?
No, can't see him yet.
I don't see anything.
Oh, that's because I didn't press share results. Okay, there you go. There's so many buttons to press with this thing.
Fantastic. The yeses are very evenly divided. That's a beautiful thing. MHRA, EMA, FDA, PMDA. I know we saw in the chat, South Africa Health Authorities. I'll review the chat again in a sec. Remote internal vendor audit, yes, and lots and lots of people had remote vendor situations and audits. And do you expect remote inspection this coming year? Lots and lots of people, 40% of y'all. And if you want to jump in, please just get your camera going so that I know we can direct some questions to you. So I'll pick on Joanne.
So hang on one sec. I am just going to stop sharing because then that means that you don't have to look at the screen. You don't need the screen anymore, do you?
No, thank you.
Okay, just one quick comment. I just put your notes up there. Please to use Q&A for questions.
Oh yes, sorry. I'm going to use the chat for questions.
Yeah, that's quite anonymous. Difficult to be anonymous on the Q&A chat, unfortunately. But all the surveys were anonymous, so you know I made them more anonymous if you wanted to. And then anyway, okay, now I'm going to stop sharing, Fran, because I think that means that you can see everybody's. It will be easier to see everybody.
Absolutely, and I think folks on camera pop up to the top of the meeting. If you're not being seen, please just jump into the chat that you've got something to say.
I think you can make them.
Yeah, I won't worry about it. So Joanne, you had a horrifying list of health authorities. Chat response. I think one of the burning questions that we had a couple weeks back was about FDA and remote access. And it seemed from some of the initial feedback that we were getting that it is rare, if ever, for the FDA to be going directly into the eTMF. Can you speak to that experience, and if you had other health authorities direct in the eTMF?
Sure. FDA, all of our FDA inspections have been on site. There have been a few complications regarding that, but they have been on site. And because FDA is not allowed to really go into computer systems, we had somebody who drove for them. So they sat next to somebody who showed them the documents that they were actually looking to view. In some cases, we've had inspectors say, gee, rather than print these documents out, can't you put them to like a box or some website where we can actually access them? We never were able to come up with a good solution for that. Because obviously you want to make sure that it's secure and reliable and meets all of the Alcoa principles. So I think overall it's been a trial with the FDA, but with other agencies, they've actually gone into our TMF. We've given them access. And one of the things that they seemed surprised by was someone let it slip that we were following them around so that we could see exactly where they had gone and what they had looked at. And they were sort of shocked that we actually did that. I was sort of surprised that they were shocked, but that was some of our experience. So they didn't go into too many things. They relied on their documents or pre-request documents for the most part.
Mary, I see nodding and smiling. You want to jump in with your experiences?
So exact same as Joanne with the FDA. We had not remote, but on site this past year, not a COVID related inspection, but on site. The FDA did not get access to our system, but other remote inspections that we've had in the past year include MHRA, the Korean Health Authority, Serbia, all getting remote access to our system. So we typically do provide remote access, and we can obviously restrict to the study and sometimes restrict to sites.
Let me ask the question in reverse to everybody who's on the meeting today. If anyone has had remote access granted to the FDA, if you could jump in, shout out, or slam it up in the chat, that would be really interesting. And I see Karen is waving her hand. Speak to us.
So the reason, because I started a whole conversation with the Reference Model Steering Committee because somebody had said to me, oh, the FDA won't access your systems. And I personally trained. It was a joint inspection. So it was an FDA, MHRA, or FDA, EMA. I can't remember which one. It was a joint inspection. And it was MHRA, FDA. The MHRA inspectors, I would expect them to access the system, no worries. But I also trained the FDA inspectors. And I then did what Joanne did and went around and had a look and saw exactly what they were looking at. I didn't tell them we were doing that, but they need to figure that out. I mean, that's the advantage of an electronic system, and the FDA inspectors did by far the most activity directly in the system, which is why I asked the question in the first place. I'd love to know if anybody else has experienced that, maybe on a joint inspection as opposed to an individual one.
So if you've had any experience with the FDA getting remote access to your eTMF, just shout it out in the chat or join the conversation.
And just one other thing to add is that many moons ago, there was an inspection, an eTMF, and it was one of the famous MHRA inspectors who said, "Can you see what I'm doing?" And we're like, "Yeah, we can see every document you're looking at." And he was like, "Oh," looking shocked. And that was maybe 10 years ago. So they should have figured it out by now. Anyway, that's all I had to add, because I was so surprised at the response I got.
Yeah.
Because obviously I'm not based in the States, so most of my inspection experience on the whole involves MHRA, EMA, etc., who absolutely have to get access, and the most recent ones actually refuse to be trained. Point blank. So anyway, I've taken enough time, but I wanted. It seems like nobody else has had that. Maybe they just picked on me.
You know, we've got a great representation here today, Karen, but it's certainly not the universe, right?
Of course.
Using Box with the FDA. Thank you, Anne. Appreciate that insight. Granted access with a ride along. Jess, thank you. Good insights. Great insights. Wanted to just take a few more minutes and sort of delve into the insanity of remote inspections and using the technologies to, you know, get as close as you can to people being in the room in a situation where there aren't people in the room. So thinking about anyone who's had experience dealing with a remote inspection over the last 18 months, wanted to ask if someone could speak to what the preparation for that was like. Is the time impact from the health authority perspective just as bad as the time impact from a sponsor or CRO perspective? Anyone want to jump in on that question?
Sure, it's Allison. I'd love to add some comments on that question. So we've had some experience with Health Canada, EMA, and MHRA. And I think the prep work, what was so important that our organization did was, you know how you do sort of mock interviews to prepare your teams? Well, since we're all going to be virtual, then if you had, say, a data manager and a study manager and a TMF representative all in the same kind of interview session, we needed somebody to take the lead to triage the question and kind of say, so-and-so, why don't you take that question? Because otherwise you get in that predicament of everyone talking over each other kind of thing. And I think that was so key. It made things run a lot smoother during those interview sessions when it was multiple people on virtually.
You really need someone manning the ship, so to speak, from the sponsor or CRO perspective to be directing the conversation rather than having some kind of free-for-all.
Yeah, and I think that, identifying who that person is, because the QA representative may not be the right person to do that particular thing. So, depending on what the subject was for the interview, then we'd all get together and prepare and then identify who's the best person that will know who to point to for each of those if a certain question comes up. So I thought that was very helpful.
Fantastic, great insight, Allison. Thank you. Anyone else have another insight or want to second Allison's recommendation?
So it's Jamie. I'll share. So in the past, with MHRA, for an example, they had access to the systems, and they conducted the length of time of their inspection was not in a concentrated week. It was in months, right? And so we're so every day, to Joanne's point earlier, we were like, where'd they go? Where'd they go in the system, checking audit trails, right? And then, it wasn't until like 3 or 4 months later that, MHRA said, okay, we don't need access anymore. So currently, at present company, we're preparing for similar, where MHRA is requesting months of access, not a concentrated week. And so we're right now figuring out what are we going to do and how are we going to, monitor, support, etc. So it is definitely very interesting, because when you think about an inspection week, it's typically, if it's on site, it's like, oh, maybe it's a week or 2 weeks, and then you're done per se. But this is more like inspection months, but it really speaks to being inspection ready, right? So having that confidence of inspection readiness.
Beautiful.
Yeah.
Thank you, Jamie. I'm throwing some of I'm paraphrasing and throwing some of the comments up in the notes. If I get anything wrong, please don't hesitate to correct the chat. Donna, you were going to jump in here.
Sure. I think in addition to just the mocks, which is to me like the big practicing for the inspection, when you're preparing for remote, if you can do a process mock, like practicing the process, because that's something very different that, we don't have a lot of experience with, right? And just making sure the technology works and making sure that everybody's comfortable with the process that we need to use to do an actual remote inspection. I think it is, you can get caught up in the process and then not really be comfortable with the inspection activities themselves.
Mm-hmm.
That's a great point, Donna. It actually triggered something else I meant to say. So for MHRA, the dossier that they've shared is they want 1-page process map that kind of explains end to end of, maybe it's, trial master file, or maybe it's how the CTMS is used. So that's also something that we're preparing as well, is a 1-page. I love that because I'm a process person and I love a picture. So so that makes sense to me.
One of the things that we had to deal with these longer remote inspections was the 90-day password resets that our company typically uses. And I'm sure there's a lot of people across the industry that have this problem. So we had to work very closely with our IT staff, and probably the hardest part was really trying to get them to understand that the inspectors just can't reset their password. That whole process and the need for it was quite an education. And then we had to work closely with them to come up with a solution, which, certainly helped everybody overall.
Amazing things that you don't think about until you have to think about it. And you got SOPs in place for 90 days, but you're dealing with the health authority. Really interesting stuff, Joanne. Thank you. I thought I saw another face of someone that was about to jump in. Nope. So is my understanding correct? Do these remote inspection preparations take longer in your mind's eye than it has taken in the past to do on-site inspections?
I don't think so. I would say it's about the same. I think that, to what everyone else is saying, the inspection lasts longer, so you're involved for a much longer amount of time. And depending on if it's an MHRA inspection, let's say, and the sponsors based in the US, then the MHRA may only be meeting with you in US morning hours. So you're going to see a much longer time for interviews. And I think it was, I don't know if it was Allison or Jamie, but we had the same experience where the inspection lasted, I think, 3 weeks, stopped for a couple weeks, picked up again in the new year, and was running for several weeks of active interviewing. But I do think too that, and this may have been particular to the specific inspection, but the demand on our TMF operations was a little bit lighter. And I thought that was interesting. It just wasn't, and maybe it didn't feel as heavy because it wasn't so intensive, right? You weren't waiting there. It was just the morning hours, and then, you know, you got a little relief. So.
The question from Adam Wood, referencing someone had thrown something up in the chat about inspectors using box access. And can anybody on the panel speak to preparations and working with inspectors who asked for Boxington or Google Docs or any of the other cloud shares?
We had an experience with that, and there was a lot of confusion where the sponsor had assumed that the inspector could see everything and they couldn't, and just navigating how it was being set up, making sure we spent the time with the inspector to explain exactly how we were organizing the documents. We just kind of assumed that they could see them, and so doing a check-in, here's what I've given you, can you confirm that you can actually see it? Because otherwise you can assume you gave them something and they can assume you never gave it to them, and then you're going to end up with a finding, right? So just being very clear on what you've provided to them and making sure they can see it.
So it's Adam here. Can I ask clarification on that? You're using Box in that scenario as some third-party cloud storage that you're kind of putting documents over there that they can view, and then they can just view them, they can take them away, they can.
It depends, right? It depends on what they ask for. If they ask to see it, then it's in a view file. If they actually ask for it, then it's in a separate section, so that you're not giving them ability to take everything that you provide to them.
Yeah,
and be serious about it though, right? If you got box view access, you can get the record.
Yeah, and what I'm intrigued at is the idea of them not accessing your eTMF, but please create this subset of documents over here on the left that isn't controlled. I'm into document control. What do you mean? Like,
I've also had them ask for actually a thumb drive. So brought a thumb drive and said, put your TMF on this thumb drive. I want to sit and look at it.
That's intriguing. Just a kind of scary attitude.
They have to get their job done, right? And all inspectors are individual human beings who have their own technology preferences and their own ways of doing things. And I think the discussions have to be clarifying, and then the follow-up has to be clarifying. As Donna referenced, you can't assume because you put it out there, that's what they're getting.
Yeah, it just doesn't seem to be consistent with how we ask every other participant in a clinical trial to behave with documentation.
Would you tell them? Yeah, Adam, would you tell them no?
Well, I think there's an argument for saying that, right?
Well, especially it's their rules coming at us, right? That require us to be following all these audit trails and securing all these documents. So for them to ask for things to be put on a thumb drive, I mean, my initial knee-jerk reaction to them asking me that, and I'm sure, Donna, you can't just say this to them, but, like would be, check, like, is that a joke? Or, like, are you guys trying to call me out on that to see if I even understand the regulations? But I've also, Fran, to your point, like sat and listened to inspectors talk, and they still want things, that one still wanted things printed out. This was like 2 years ago with like, sticky notes on all the right pages that they wanted. So I get it.
I think, to that point, they're just their preference, and we've added a whole new dimension of preference by introducing technology.
For sure. I've heard the argument from health authorities that Box or any other sort of sharing device is not essentially different than getting things sent by FedEx, right? Having sponsors make copies and FedExing them, it is not considered to be like the official source. It's noted to be a copy, but they need those copies they perceive the need for these copies to get their job done. It's tough territory for sure. And anybody else want to speak about sort of unregulated content inspection? Any other comments?
Fran, this is Marion, and just wanted to share that, I helped organization through an FDA inspection, and it was about 4 years ago. And even at that time, the FDA inspector asked for a SharePoint, a share file, to be able to be used for when he asked for documentation. And he had limited access, obviously, to that. And what he would do is at night, he would finish reviewing. And I agree. They stipulate that it's not any different than if you had made them a copy and they took the copy. And in fact, I think for us, it's more secure this way, because then you know exactly, you will always have that file, right? Know exactly what you handed them. And there's no, I guess, fear or worry about what's really happening with that sheet of paper, ultimately.
No ambiguity there, yeah?
Yeah.
Really tough territories we're dealing with here. I want to be cognizant of the time, and we have a few other details to conquer in the meeting. Any other last topic or any other last comment folks want to dial into?
Fran, just to confirm that the last 2 slides will take a minute.
Oh, okay. Well, then let's.
Because it's one, and they don't. And we don't even need to. I think if people have got more questions, I'd carry on this.
Perfect.
We're just going to wrap up at the end with a minute to go to talk about potential events coming up and the next date. That's all. So carry on.
Great. So I'm going to go now round robin with the folks who are on camera who have spoken up. Your #1 recommendation for preparing for a remote inspection, and I'm picking on Mary first.
I did not prepare, so I'm trying to think of what's the #1 recommendation, and I don't really think it's different. Okay. Well, I was going to say, I don't think it's different. I mean, the way we prepare for an inspection, whether it's remote or in person, is the same, right? So the fact that we're on video instead of sitting in with them changes it a little bit. And I think some of the deficiencies of that format you noted early in, Fran. But other than that, I don't think our prep is different.
Amazing. Go ahead, Jamie.
Collaboration with your internal stakeholders who are part of the process.
Collaborate, educate.
Collaborate. Yes.
Allison, I saw you jump in. Any #1 recommendation to prep?
Yeah, I would add that I haven't heard yet is I would see if the QA group can ask the inspectors if there's an opportunity to present on the TMF overview prior to them jumping into the inspection. We found this helpful kind of to let them know what our index looks like, let them know we have a TMF plan, some of those basics, how we're set up. Not this is how you navigate the system or anything. It's more of a, this is how we manage the TMF and kind of level set them, especially if there's nuances of migrations that have happened or any major things.
Allison, can I just ask? So Allison, I just wanted to ask if you don't require that. So when we are having an inspection, as we give access to the inspectors to our systems, we provide all those types of materials, and they confirm receipt and review before we activate those accounts. So it's one of the prerequisites that we're stipulating, I guess.
Yeah, so we do have, training that we provide, like system training for inspectors. It's like a PowerPoint presentation or something like that. And we'll do demos with them if they want before they're given access. But this is more of a overview of, say they're looking at a few studies. These are some key nuances for those studies when it comes to TMF, like it exchanged multiple eTMF systems, or some of those, kind of like a storyboard. And some have requested that, but others haven't. But we've asked, can we do that? like for a half hour, 20 minutes, 10 minutes, whatever.
Yeah.
And it seems to help answer their questions. It kind of level sets them before they start getting into the inspection. Yeah. So.
Yeah.
Sure.
We do the same thing. We call it an orientation to our inspectors so that they know, first of all, how our system is set up, where they'll find things. We give them our inventory list. We give them the TMF plan. We also give them tips and tricks, so it might make their life a little bit easier. And so far, they've always told us, well, maybe 15 minutes. But they've had so many questions that it has always gone over. So you can tell that they're very interested in really understanding better.
That's good. Great recommendation. And so would that also be your #1 remote prep recommendation?
Yes. Yeah.
That's good. Don, I haven't picked on you yet. #1 remote inspection preparation tip.
Practice and test the technology.
Oh, I had a situation where the Wi-Fi went out, did you?
No, just people knowing how to use, just uploading things to the right places and make, to Mary's point, the end game isn't different, right? But just how you play the game in some organizations is different just because of the different technologies that we're leveraging, and we're all doing it not in the same room, right? Like, so we're all in different places. And so the communications piece of it is critical, and that's part of the technology.
Sure.
And can I ask a question? So how many of you use a system, like we use something called Primo, which is a chat that's always open, where everything that's happening in the room is live recorded, even though you're not there, you're getting it. So just like you would for a in-person inspection where somebody's recording everything, we're doing the same for a remote inspection. Is it similar for all of you?
Sort of like back office chat technology. Is that a good description of it?
Yeah, all the requests are recorded, all of the conversations are being conveyed real time. Any questions, people who are not in the room can contribute to help with the conversation.
And what was the tool that you referenced, Mary?
We call it Primo. I don't know if that's our name or if that's a technology name.
Someone else jumped in on the chat with Utopia. You got another one?
We use Teams.
Okay.
I think it depends on the company and the size of the company. Smaller companies have less access to technology, right? So if you have an audit tool that you can use, that's fantastic. But even then, we had several Zoom rooms going at the same time. And so then there's several different chats. And if you're in one Zoom room, it's harder to you're not seeing what's going on in another Zoom room.
Yeah, I don't know what technology we use, but it is live scribing, like a live scribe, so we can see what's going on even as an outsider, to see if something's going to come up in our area of focus that we should be prepared for. So I don't remember if it was Primo or what they used, but there was an actual, not really texting back and forth or IMing, but an actual live scribe where it said, inspector asked this person responded with this, that kind of thing.
Yeah. But I think
some different solutions up there in the chat for people to grab.
To Allison's point earlier, that mock inspection, or we used to call it at a long previous company, stump the band, right? So I used to do this with my team and ask them questions like I was the inspector, and then kind of hear their response, and then we would critique them at the end and say give them feedback. Because sometimes you get those off the wall questions that you want them to be able to answer, straight face, not, and correctly. So.
Nice, thank you, Jamie.
Yeah.
Do that in the chat too, and we'll, Karen, before we close the meeting, if you can protect all the chat, that would be great. So
absolutely no problem at all. Sorry to rush you, but we have 1 minute. So I just want to say, Fran, thank you. Fabulous fabulous session. I'm going to put up the event slide because that is the one that we were going to talk through. Jamie, I'm just going to explain that this will be out there. This is all the events. I added the MHRA GCP seminar in 7th to 9th of March. These are all the non-vendor events. So this is all the commercial conferences, etc. And I will, it obviously will all be in the deck. And as we're about to go, I just want to say that our next planned meeting is the 14th of March. If anybody thinks there's a reason why it shouldn't be the 14th of March, it's the week after the MHRA one. So I'm sure I know I'm going to the MHRA one, so we can give some feedback from that. If there's anybody who thinks we shouldn't, there's a problem with that date, let me know, because I don't always know about all the holidays. But otherwise, just to say thank you very, very much to everybody. Great session, lots of great questions. And Fran, I will make sure that we capture the chat. I don't know whether maybe you want to produce one extra slide that I could then put into the deck based on the chat. And then, so we won't, so if I'll send you the chat immediately afterwards, and there will be a link to the recording that will go up on the website. The slides will go up on the website, but Fran will also summarize the comments in the chat onto a slide, and I've already added the polls in. So thank you very much, everybody. Happy New Year again. Lovely to speak to you. And don't forget to comment on the CDISC position paper if you have any comments.